Working in a clinic with underserved patients, one of the biggest lessons I learned was the value of being a healthcare professional who cares about all of the factors that affect the patient's access to care. Too often, these factors are ignored, and I found that patients are typically open and honest about their struggles if you just take the time to ask them about it. When we ask, we find out, and when we find out, we can directly help and connect our patients with resources to help foster equitable care.
Interacting with my project population showed me the importance of effective communication in healthcare. I found that conveying difficult medical information in a clear and accessible manner is essential for empowering patients to make informed decisions about their health. I also learned the importance of cultural sensitivity in healthcare. Each patient brought with them unique cultural backgrounds, beliefs, and practices that influenced their understanding of medicine. This experience emphasized the importance of respecting and incorporating cultural nuances in medicine to ensure effective and patient-centered care.
During my Schweitzer Fellowship project, I rediscovered the joy and the energy that service brings. Engaging with teenage participants served as a powerful reminder of the significance of empathy and cultural sensitivity in our interactions. Adapting my project to meet their unique needs not only strengthened my ability to connect, but also fostered personal growth. This transformative experience has molded me into a more compassionate and culturally competent future healthcare professional.
I work with people living with HIV, and there are many outside factors that contribute to habits they might have, inability to pay for medicine, or even stay adherent. So this helped me see patients as a whole, not just as a diagnosis, and helped me grow as a leader in really advocating for changes that need to happen in their communities and in their lives.
As a Schweitzer Fellow, I created Tight Knit, which is a weekly knitting program for cancer patients, survivors, and caregivers. As a result of my project, I get to meet with patients on a weekly basis in an informal setting, and I often get to hear stories about their interactions with their doctors. Hearing about what their physicians have done to make the patients feel heard and understood have given me concrete examples of what I should do as I embark on my clinical rotations and my future career as a physician. In addition, I've learned that there is an ongoing need to bridge supportive care services with patients actively undergoing treatment, and that is something that I will continue to advocate for beyond my fellowship year.
This year as a Schweitzer Fellow, I learned the profound impact of meeting people where they are. Engaging with my participants, I learned invaluable lessons about resilience, resourcefulness, and the importance of community support. This experience has instilled in me a deeper understanding of the complexities of health equity, and specifically for my population, I further understand the urgent need for accessible, nutritious foods to food-insecure populations. I'm committed to integrating these insights into my future work, ensuring that I approach every individual with empathy, understanding, and a genuine desire to promote their well-being.
One thing in particular I learned about my project participants was the importance of trust. In part, because in many cases where marginality is a factor in the selection of the project population, there can also exist feelings of being objectified amongst the individuals that make up that community. So my invitations to participate in the project were initially met with some degree of resistance and an equal amount of suspicion. From that initial contact with participants, I learned that before I could build a rapport with the participants, a trust relationship had to be established.
I've always heard people talk about specific qualities that make a good leader. That's the typical conversation, but that remains fairly individual focused. This year, I learned that while a certain degree of self-awareness is important, being a good leader extends beyond the qualities you possess as an individual. Beyond yourself, what really matters are the people rallying alongside you and supporting you. This year, I got to experience what it feels like to have people believe in me, and that had an unbelievable impact on my project and me.
My view on what it means to be a leader has changed tremendously. By being able to create this project from scratch with my partner, Maya Singleton, I was able to explore characteristics about myself that I didn't before. I tend to be more of a background individual, behind the scenes, to create something great, but this time I had to be on the forefront and be a leader. A leader has to be confident and optimistic no matter the obstacles that come their way, and I ended up embodying those characteristics within this project.
Through my time with ASF, I've gained many valuable insights into what the approaches to leading can look like. I've watched my partner and my peers take on each obstacle with determination, gusto, and a never-ceasing enthusiasm for improving both public health and the future of their respective professions. I think the most important lesson on leadership I'm going to walk away from this experience with is that obstacles and failures are just stepping stones to help you reach greater heights.
One valuable aspect of the Albert Schweitzer Fellowship experience has been the community of servant leaders from multiple disciplines, both as guest speakers and other fellows. It has given me a fresh perspective on leadership and given me both the permission and confidence to seek out opportunities of leadership in areas that I wouldn't have otherwise looked for.
Before starting the Albert Schweitzer project with Paul, I thought of leadership primarily as a practice that involved knowing things and knowing what to do and being able to address challenges with a foreseen plan. I now appreciate how much more it is a matter of being happy with uncertainty and embracing it.
Great leaders are not focused on being a leader. They're focused on making a difference. Hence, it is not about the role, it is about the goal. A leader is someone with a clear vision of what needs to be accomplished and has a capability to act and motivate others towards achieving that purpose. This ASF experience has enforced that in order to lead effectively, one must lead by example.
It's a sad reality, but everyone does not have a fair and just opportunity to obtain their optimal health. I'm thankful that ASF provided training sessions to help me better understand social determinants of health and other disparities people face. The field of optometry may not be perceived as a vital healthcare discipline. That is, until someone has severe eye pain or sudden vision loss. Nonetheless, people need clear vision for day-to-day activities, but many underserved populations cannot afford routine care or corrective glasses. Some never receive vision care, especially in the Hispanic community.
Concepts like social determinants of health, I think, are buzzwords that get thrown around a lot these days. And for me, it was really easy to view them in a very mechanical and mathematical way, kind of like variables that can be plugged into an algorithm to predict health. And my time working as a fellow with some of the most vulnerable populations in my community allowed me to see that it really isn't that simple. You might give someone a strategy to get 30 minutes of exercise, but that doesn't help the person that lives in a neighborhood that doesn't have sidewalks, or perhaps someone who doesn't feel safe walking on those sidewalks. So for me, I really realized that a lot of these issues are interdependent and have many layers of complexity, and it is only through real conversations with intentional questions that you can begin to appreciate the scope of the issue.
Being an ASF fellow has shown me what it means to be a part of health equity in the context of eye care. By providing free eye exams to people, I am able to give them their best corrected vision and really improve their quality of life, especially when their eye health may not be at the forefront of their priorities. I hope that I'm able to inspire others to do the same.
During this year of service, I've witnessed the disparities in access to hearing health care and the profound impact untreated hearing loss can have on individuals' lives. This experience has highlighted the urgent need for more equitable distribution of hearing healthcare services, as well as the importance of raising awareness and advocating for individuals living with limited resources. This experience has reinforced my commitment to advocating for equal access to quality hearing healthcare for all.
Our ASF project has taught us a resounding message on how important the skills of resilience and persistence are when creating a meaningful community impact. We never could have predicted all the hurdles we'd have to jump over the year, but I'm extremely happy with how our project ended up. I've learned that it's not only important to have personal passion for a project idea, but to spread that same excitement to other community partners and stakeholders. Because of my time with ASF, I know I'll be a better physician who can return to the communities I care about and be an active player in creating better health outcomes for everyone.
Through my education and experience as a health professional, I have gained a profound understanding of the power and privilege inherent in my role. This awareness has significantly influenced how I engage with people with cultural humility. I practice active listening to truly understand a patient's perspective and concerns. I use my voice and platform to raise awareness and promote policies that support underserved communities. By embracing cultural humility, I aim to create a healthcare environment where all individuals feel valued, respected, and understood, fostering a more equitable and inclusive healthcare system.
As a fellow, I've learned a lot about what it means to be a healthcare professional. A lot of people will take exactly what I say, even though I'm a student, as gospel. So I'm finding that it's incredibly important for me to have evidence to back up whatever I say, whether my patients ask for it or not, and to be sure of what I'm talking about. Healthcare professionals are leaders in our communities, and we need to make sure that we remember that we are just people. And as people, we have an ability to fail, and that's okay sometimes.
The Albert Schweitzer Fellowship serves as a reminder that many of us are here today because of the generosity and support of others. Access to higher education is not universal, and being in a position to be able to provide care for others is a privilege. I've come to understand that addressing educational access, amongst other social determinants of health, demands a multidisciplinary strategy. The Albert Schweitzer Fellowship highlights the importance of educational access in Alabama and its broader implications for health and well-being.